Mesenteric cyst. This topic is mesenteric cyst. It is like a benign cyst, which is usually found in the paraumbilical region. So it is classified into two types, which is lymphatic type or enterogenous type. Chylo lymphatic type और ये है enterogenous type. So this one is like enterogenous type. This is what happens is there is a thick cyst formation, and the wall of this cyst is formed by the bowel. Wall is formed by the bowel, and the blood supply is common as that of the bowels blood supply. Content of this one is bowel itself, sequestrated bowel tissue, and fluid inside it is turbid. So if it is turbid fluid, then transillumination is obviously transillumination will become negative. So this one is like less common type. The most common type is chylolymphatic type. Most common is chylolymphatic type. And for this, the wall is thin. Blood supply is independent. It has its own blood supply. Content is sequestrated lymphatic tissue, and the fluid is clear. That's how it is forming, giving transillumination test positive transillumination test. So mesenteric cysts are of two types, chylolymphatic and enterogenous type. And chylolymphatic mesenteric cyst is more common. It has its own blood supply and has sequestrated lymphatic tissue, and it is thin, and the fluid is clear, which is giving positive transillumination test. Whereas enterogenous is less common, but the wall is thick, which is of the bowel itself. Fine. And the content is bowel, sequestrated bowel tissue, and blood supply is shared with the bowel's blood supply itself. The fluid is turbid, and resulting transillumination test is negative. See this this is abdomen. Let's say this is abdomen. So this is this how the mesenteric tissue will run. Mesentery will run. So if there is cyst, there is a formation of cyst. Let's say what happens is cyst causes the attachment of mesentery to the attachment of this mesentery to the posterior abdominal wall. Fine. So which is in turn the clinical feature is mesentery attachment to retroperitoneum. ये सिस्ट जो है वो इस मेजेंट्री को रेट्रोपेरिटोनियम से अटैच करेगा. And there is a para-umbilical swelling itself. What is teloxine? Teloxine is generally seen in this mesenteric cyst. What happens is there is if we are going to press over here, then this swelling moves towards the right angle of the mesentery. If we are going to press here, then it is going to move to the right angle of this mesentery back. So this is known as a teloxine. That is the movement of swelling at right angle to the attachment of mesentery. How are we going to investigate? Investigation is CECT. Surgery is the management of choice. Surgery. For bowel, we are going to resect and anastomose. For bowel, we are going to resect and anastomose. That is for this one, enterogenous. We are going to resect and anastomose. Whereas for this one, chylolymphatics, we are going to do enucleation. We are going to cut it out, resect it out. That's it for mesenteric cyst. Fine.